Hi everyone, I am Dr. M. Parimala, Assistant Professor, PG and Research Department of Microbiology, St. Joseph's College of Arts and Science, Autonomous Cuddalore, Tamil Nadu. I am going to present a topic Assessment of Host Defense Systems. Let's see the introduction. After getting an infection, the host can produce a variety of antibiotics, that is, the complex glycoproteins, which is commonly known as immunoglobulins, and that bind to the specific microbial antigenic targets. Antibodies can help to eradicate the infecting microorganisms by attracting the host WBC cells and activate the complement system. Host defenses that protect against infections include natural barriers, example skin and mucous membrane. Non-specific immune responses that is mediated through the phagocytic cells such as neutrophils and macrophages and their products. Specific immune responses that is mediated through the antibodies as well as the lymphocytes. First, we will see about the skin as the natural barrier. The skin usually bars the invading microorganisms unless it is physically disrupted. That is mediated through arthropod vectors or through injury or through IV catheters, intravenous catheters, or through surgical incision. Exceptions include the following: human papilloma virus, which can invade normal skin and causing warts. Some parasites, example Strongyloids streptococcus, that cause infection, which is commonly known as threadworm infection. Next one is the mucous membrane as a barrier. Many mucous membrane are bathed in secretions that have antimicrobial properties. For example, cervical mucus, prostatic fluid, and tears contain lysozyme, which splits the muramic acid linkage in bacterial cell walls, especially in gram-positive organisms. And in case of gram-negative bacteria are protected by the lipopolysaccharides, that is LPS, which is present in the outer membrane. Local secretions also contain immunoglobulins, especially IgG and secretory IgA, which prevent the microorganisms from attaching to the host cells, and proteins that bind iron, which is essential for many microbes. Next one is the respiratory tract as the airway. That is, the respiratory tract has upper airway filters. If invading organisms reach this tracheobronchial tree, the mucociliary epithelium, which transports them away from the lungs. Coughing, the process which helps to remove the microbes. If the organisms reach the alveoli, alveolar macrophages and tissue histiocytes will engulf them by the process called phagocytosis. However, these defenses can be overcome by large number of microorganisms by compromised effectiveness resulting from air pollutants like cigarette smoke, the interference with protective mechanisms, for example, endotracheal intubation, tracheostomy, or by inborn defects, for example, cystic fibrosis. The endotracheal intubation is done to keep airway open in order to give oxygen, medicine, or anesthesia. Tracheostomy is the medical procedure which is used to help oxygen or air to reach the lungs by creating an opening, that is, the incision from outside of the neck. And cystic fibrosis, it is the life-threatening disorder that damages the lungs and the digestive system. It affects the cells produce mucus, sweat, and digestive juice. It causes these fluids to become thick and sticky, and then they plug up the passage. Next, we will see about the gastrointestinal tract. The gastrointestinal tract barriers includes the acid pH of the stomach and the antibacterial activity of pancreatic enzymes, bile, and intestinal secretions. Peristalsis and normal loss of intestinal epithelial cells remove microorganisms. If peristalsis is slowed because of the drugs like belladonna or opium alkaloids, this removal is delayed and prolongs some infections such as symptomatic shigellosis and Clostridium difficile induced cholecystitis. Compromised gastrointestinal defense mechanisms may predispose patients to particular infections. Example, A. chlorohydria predisposes to Salmonella, Campylobacter, and Clostridium difficile infections. This achlorohydria is a condition where the stomach doesn't produce hydrochloric acid. So there won't be the acidic pH in the stomach. Normal bowel flora can inhibit pathogens. Alteration of this flora with antibiotics allow overgrowth of inherently pathogenic microbes, for example, Salmonella typhimurium. Overgrowth and toxin production of Clostridium difficile or superinfection with ordinarily commensal organisms like Candida albicans. The next one is the genitourinary tract. In women, the hypertonic state of the kidney medulla and the urea, the genitourinary tract barriers include the length of urethra, that is 20 centimeter in case of men, and the acid pH of the vaginal secretion. The kidneys also produce and excrete large amount of Tam-Hopsel mucoprotein which binds certain bacteria, facilitating their harmless removal. Now we will see about the non-specific immune response, that is the innate immune response. First one is the cytokines. It includes interleukin 1 and 6, tumor necrosis factor alpha, and interferon and gamma are produced principally by macrophages and activated lymphocytes and mediate an acute phase response that develops regardless of the inciting microorganism. The response involves fever and increased production of neutrophils by the bone marrow. Endothelial cells also produce large amounts of interleukin 8 which attracts neutrophils. The inflammatory response directs immune system components to injury or infection sites and is manifested by increased blood supply as well as the vascular permeability, which allows the chemotactic peptides, neutrophils, and mononuclear cells to leave the intravascular compartment. Microbial spread is limited by this engulfment of microorganisms through phagocytosis, that is, through the neutrophils and macrophages. Phagocytes are drawn to microbes via chemotaxis and engulf them, releasing phagocytic lysosomal contents that destroy the microbes. And also, the oxidative products such as hydrogen peroxide are generated by the phagocytes and kill ingested microbes. When quantitative or qualitative defects in the neutrophils results in infection, example chronic granulomatous disease, the infection is usually prolonged and recurrent and responds slowly to antimicrobial drugs. Staphylococci, gram-negative bacteria, and fungi are the pathogens usually responsive. We will see about the specific immune responses, that is the adaptive immune responses. These responses are carried out by WBC cells called lymphocytes. After infection, the host can produce a variety of antibodies called glycoproteins, which is commonly known as immunoglobulins, that bind to the microbial antigenic targets. Antibodies can help to eradicate the infecting organism by attracting the host WBC and activate the complement system. The complement system destroys cell walls of infecting organisms usually through the classical pathway. Complement can also activated on the surface of the cell. Antibodies can also promote the deposition of substance called as opsonins. Opsonins are proteins which bind to the foreign particles and microbes and marking them. The complement protein, the antibodies can promote the deposition of the substance, that is opsonins, that is the complement protein C3b on the surface of microorganisms which helps to promote the phagocytosis. And the process opsonization, it is the tagging foreign pathogens for elimination by phagocytes, is important for the eradication of the encapsulated organisms, especially pneumococci and meningococci. And now we'll say about the host genetic factors. For many pathogens, the host genetic makeup influence the host susceptibility and also the resulting morbidity and mortality. For example, patients who have deficiencies of the terminal complement components C5 through C8, perhaps C9, have an increased susceptibility to infections that is caused by Neisseria species. Example, meningococcus as well as gonococcus. And the clinical assessment of host defense can be made by, that is, the defense mechanisms are the determinants of the infection. Allergy in surgical patients is a signal of broadly based immune deficits, which include abnormalities in the specific and local non-specific antibacterial defenses and related life-threatening sepsis. That is the absence of normal immune response to the particular antigen or allergen. So, analysis of these abnormalities and other risk factors allow us to generate a long predictive equation of individual probability of death. Thank you.